Senator Gazelka.
I move that further proceedings under the roll call be dispensed with and Sergeant Vaughns be instructed to bring in the absentee members.
On that motion, all in favor say aye. Those opposed say no. Motion prevails and the Sergeant at Arms will bring in the absent members. Members, we're working off the addendum, and remaining under motions and resolutions, we'll revert to the third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce that the House refuses to concur in the Senate amendments to House File Number 3100, a bill for an act relating to health care establishing an emergency insulin program. The House respectfully requests that a conference committee of 5 members be appointed thereon. Howard, Liebling, Morrison, Albright, and New have been appointed as such committee on the part of the House. House File Number 3100 is herewith transmitted to the Senate with the request that the Senate appoint a like committee. Patrick D. Murphy, Chief Clerk, House of Representatives.
Senator Jensen.
Thank you, Mr. President. I move that the Senate accede to the request of the House for a conference committee on House File Number 3100, and that a conference committee of 5 members be appointed by the Subcommittee on Conference Committees on the part of the Senate to act with a like conference committee appointed on the part of the House.
Discussion on the Jensen motion. Seeing none, all those in favor say aye. Those opposed say no. Motion prevails. Remaining under motions and resolutions, we'll continue to the fifth order of business, reports of committees. Senator Gazelka.
Mr. President, I move the committee reports printed in the addendum be adopted.
On the adoption of the committee reports, all those in favor say aye.
Aye.
Opposed say no. Motion prevails. Continuing under motions and resolutions, we'll move to the sixth order of business, second reading of Senate bills. The Secretary will read the Senate file numbers.
Senate file numbers 2043, 2919, 4217, 3113, 3556, and 3683.
These Senate files are given their second reading. Remaining under motions and resolutions, we'll move to the eighth order of business, introduction and first reading of Senate files. Members listed in the introduction calendar, the addendum are Senate file numbers 4410 through 4444. These Senate files are given their first reading and referred as indicated. Continuing under motions and resolutions, the ninth order of business, we have one author's motion listed in the agenda. On the adoption of the author's motion, all those in favor say aye. Opposed say no. Motion prevails. Senate resolution numbers 217 through 225 will be referred to the Committee on Rules and Administration. Remaining under motions and resolutions, Senator Gazelka.
Mr. President, I move for a brief recess for the appointment of a conference committee.
On the motion to recess, a brief recess, all those in favor say aye. Opposed say no. Motion prevails. The Senate is in recess. The Senate will come to order. Senator Gazelka.
Mr. President, is there a privilege report at the desk?
There is a privilege report at the desk. The Secretary will read the privilege report.
Senator Gazelka from the Subcommittee on Conference Committees recommends that the following senators be and they hereby are appointed as a conference committee in House File Number 3100. Senators Jensen, Benson, Pratt, Rosen, and Wickland. Senator Gazelka moves that the foregoing appointments be approved.
Discussion on that motion? Senator Gazelka renews his motion. All those in favor say aye. Opposed say no. Motion prevails. Remaining under motions and resolutions, we will revert to the fifth order of business, reports of committees. The Secretary will read the report.
Senator Rosen from the Committee on Finance, to which was re-referred Senate File Number 3878, a bill for an act relating to transportation.
So what's this one?
Reports the same back with the recommendation that the bill be amended as follows. Delete everything and just a minute. And when so amended, the bill do pass.
Senator Gazelka.
Mr. President, I move the committee report read by the Secretary be adopted.
Discussion on that motion? Seeing none, all those in favor say aye. Aye. Those opposed say no. Motion prevails. Senate file, let's see, the Secretary will give Senate file 3878 its second reading.
Senate file number is 3878, a bill for an act relating to transportation.
Second reading. Senator Gazelka.
Mr. President, I move that an urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to Senate File 3878, and then the rules of the Senate be so far suspended to give Senate File 3878 now in general order as its third reading and placed in its final passage.
Discussion on that motion? Seeing none, all those in favor say aye. Aye. Opposed say no. Motion prevails. Discussion on Senate File 3878, Senator Frentz.
Thank you, Mr. President. Members, for over 40 years, southern Minnesota has counted Highway 14 as the heartbeat. Over that time, over 100 Minnesotans have lost their lives on that road, and Senate File 3878 is a bill to complete 4 lanes, Nicollet to New Ulm, Minnesota. The bill allows the Commissioner of Transportation to apply for a TIFIA loan. This is a federal loan under very favorable terms. By passing this bill, we will create a special reserve account funded not with tax dollars, but with an appropriation of overweight truck limit fees. 35-year loan, 49% of the loan payment back, about 1.2% is the repayment percentage. On behalf of all the people of southern Minnesota, on behalf of the members here who have Highway 14 through their district, among them Senator Miller, Senator Nelson, Senator Senjum, Senator Jasinski, Senator Draheim, Senator Rosen, myself, and Senator Dames, and all the families that have lost loved ones on that road, and for all the businesses and the schools and the sports teams and the truckers, and for everyone going forward, I ask that we pass this bill, allow this stretch of road to be completed. And I want to specifically thank not only the Commissioner of Transportation and the Commissioner of MMB for their work on the financing here, but my co-authors. Many times we come to this floor and talk about partisan issues. Not today. I want to thank Senator Dames, Senator Rosen, Senator Jasinski, and Senator Dibble for us bringing this bipartisan bill to complete Highway 14, 4 lanes from Nicollet to New Ulm. Thank you very much, Mr. President.
Discussion on Senate File 3878, Senator Dames.
Well, thank you, Mr. President and members. This has been a long time coming, and certainly appreciate the opportunity if we could get your green vote tonight to pass this bill out. I want to thank all of the folks that were on the bill. Plus, I know this process has been going on about 50 years now, so there's been many, many different groups and many legislators and different governors and different people at the department. So I would ask for your green vote, and this is a good bill.
Further discussion on the bill, Senator Jasinski.
Thank you, Mr. President. I want to thank Senator Frentz as well, Senator Dames, Senator Rosen, Senator Dibble, in support of Senate File 3878. We were very fortunate 2 years ago to get the 12.6 miles approved on the east end, and to have the 12 miles on the west end completed or approved just 2 years later in hopes of this getting approved is very great for southern Minnesota. Senator Frentz said that'll be 24 miles of safe highway that will save lives in southern Minnesota. So again, thank you for everybody and their support.
Further discussion on the bill. The Secretary will give Senate File 3878 its third reading.
Senate file number 3878, a bill for an act relating to transportation.
Third reading. Members, any final discussion on the bill? We're on final passage of Senate File 3878. Seeing no further discussion, the Secretary will take the roll. All members having voted who have the desire to vote, the secretary will close the roll. There being 55 ayes and 0 nays, the bill is passed and its title agreed to. Senator Gazelka.
Thank you, Mr. President. I move for a brief recess. We're waiting for the committee report. Stay in your seats or stay close.
On the motion for a brief recess, all those in favor say aye. Opposed say no. Motion prevails. The Senate is in recess. Senate will come to order. Remaining under motions and resolutions, will continue with the fifth order of business, reports of committees. The Secretary will read the report.
Senator Rosen from the Committee on Finance, to which was referred Senate File Number 4334, a bill for an act relating to public health, transferring money for deposit in the Public Health Response Contingency Account, reports the same back with the recommendation that the bill be amended as follows: delete everything after the enacting clause and insert, and when so amended, the bill do pass.
Senator Gazelka.
Mr. President, move the committee report read by the Secretary be adopted.
On the adoption of the committee report, all those in favor say aye. Those opposed say no. Motion prevails. Senator Gazelka.
Mr. President, I move that the urgency be declared with the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to Senate File 4334, and that the rules of the Senate be so far suspended as to give Senate File 4334 its second and third reading and placed on its final passage.
Discussion on the Gazelka motion. Seeing none, all those in favor say aye. Aye. Those opposed say no. Motion prevails. The Secretary will give Senate File 4334 its second reading.
Senate File Number 4334.
Second reading. Discussion on Senate File 4334. Senator Benson.
Thank you, Mr. President and members. I am grateful to bring before this body emergency funding in response to the COVID outbreak that Minnesota is facing and anticipating. This outbreak is creating anxiety for Minnesotans for many reasons, but it is stressing our healthcare system, and we are only at the beginning. We don't know when or how this will end, but we do know that we can do our part to support those who will be at the very heart of this. Last week, we sent $21 million to support the Minnesota Department of Health and their public health response. And they are doing all they can to prepare and to test and to advise as we attempt to flatten the peak. Walking alongside them, our nation-leading healthcare system, our hospitals are working together to prepare to care for patients, preparing for what we don't understand, but they are well qualified to care for us as they prepare. I have learned so much about our healthcare system, but every time they are faced with a challenge, I learn something more, and I am incredibly grateful for the work that our healthcare system, our hospitals, nursing homes, clinics, long-term care facilities, and the men and women who work in those facilities. Every day they get up ready to take care of us. We cannot do their work for them, but we can support them. And so we are here today with specific money, $50 million to start, rapidly moving grants to help them with items related to flattening the curve and immediate patient care, and another $150 million to eligible entities, again, to support them as they move through this unknown. So, members, I give you Senate File 4334. We begin with an oversight group made of hospitals, ambulance services, emergency management, and public health agencies. They will help MDH know where hotspots are emerging and where the resources are most needed. The Minnesota Department of Health will then allocate funds to hospitals, nursing facilities, settings with assisted living, healthcare systems, as they plan on an emergency basis for COVID response. They can be used for the establishment of temporary sites to isolate or quarantine individuals, temporary conversion of space for another purpose that will eventually revert to its original use. So think, for example, of a space in a hospital that is not currently used as an isolation space, but that would be converted and then would revert back. That is what we mean under that space, under item number 2. Staffing and overtime, we know that they are going to need more staff and that some of their staff will in fact be impacted. Staff training, orientation, purchase of consumable protective equipment for staff, visitors, and patients, development and implementation of screening. We are very fortunate to have screening and testing being developed right here in Minnesota so that we can catch up. We were a little behind the curve, but we're going to have to keep working to catch up. Patient outreach, emergency transportation of patients. Members, there may come a point when patients need to be moved from one facility to another, and when you have an infectious disease, that transport looks a little different than a regular transport. Information technology, supportive telemedicine. One of our facilities in 48 hours did more telemed than they did in the previous year. So Minnesotans are catching on with our social distancing. Accessing medical care via telemed is a wise choice. And then members, we see that this is only for the COVID response under Section 3. Under this section, we're familiar with it. It's where we put the response for the public health labs. In this case, we waived the LAC review because we are so proximate to it's being used. As we move on to Article 2, the Healthcare Response Fund, this is $150 million. The same eligible providers and the same types of things the grants can be used for. We do have a legislative advisory commission review for grants, for expenditures that exceed $1 million. The commission has 2 days to review it, and they have to have a majority on both sides to stop it. Its default is that it would pass. But members, if we see something that we don't agree with or we don't think is in the intent of the law, we can work together to stop it. The grants need to consider needs across the system based on the different regions we have around our state. And again, that advisory board is going to be critical to seeing where an outbreak is occurring, where we might need more resources. They have to consider if the provider has other resources, reimbursements that they can use in place of state dollars, and whether that provider does have a lack of access to funds to properly respond. The applicant has to share some financial information. That information is private. The allowable uses of funds, members, we covered in the first article of the bill, same uses, same purposes. And then finally, members, there is in subdivision 7, a temporary health care site. If for some reason a provider is not reasonably capable of establishing and opening a temporary site, if their system is overwhelmed, the Minnesota Department of Health can work with their local government to establish a place where patients could be cared for, where they could be treated. It would be extraordinary to have that in Minnesota, and I wanted to call your attention to it. As a condition of accepting these grants, the eligible provider cannot bill uninsured patients. The eligible provider, if they are out of the patient's network, must accept the median network rate and agree not to balance bill that individual. If the funds are used for unauthorized purchases, the commissioner may call them back, and they must seek assistance from other sources. And if they do, and those funds exceed what the state expended, then they need to give some of the money back, the commissioner, and that will revert to the general fund. There is an evaluation that will come to us in January. The transfer, you'll note, any unobligated, unexpended amount shall transfer to the general fund. So members, if we get federal dollars in that exceed the need that we have, this fund might end up with money back in it, and we will have that back in the general fund next February. In Article 3, remember I mentioned the use of telemedicine as one of the things Minnesotans are starting to do? Well, we make sure that if you are at home and you engage in a telemedicine visit, it counts as a point of origin. Right now, it's clinics or a facility, and so we want to make sure that if you are at home and you're accessing your care from your home, as we would encourage you to do, that is reimbursable under various types of coverage. And so members, with that, I am grateful for the opportunity to have carried this bill, and I'd be happy to answer your questions.
Discussion on Senate File 4334. Senator Herr.
Thank you, Mr. President. I rise to commend the authors and the body of the Senate for bringing this bill forward with urgency. As a senator that represents a district with disparities and high percent of low income and metro transit dependence and non-English speaking with cultural barriers, I want to know if this bill or this contingency account will provide resource to streamline communication to these communities, as well as having intake lines in other language for their information. And Mr. President, I would like to see if Senator Benson will yield.
Senator Benson will yield. Senator Hur.
Senator Benson, I'm not going to attempt to amend to this bill, but I'm just want to ask if this bill has the flexibility in its account to fund communication to communities that I have just mentioned.
Senator Benson.
Thank you, Mr. President. Thank you, Senator Hur. I would put that under the seventh point of the options, patient outreach activities. Those would have to, of course, be suitable for the culture that they were trying to outreach to, the population they were trying to reach. I know Senator Hayden had raised a question about the Somali population. I think if you're trying to reach them to help flatten the curve, that you would make sure that it was appropriate and welcoming so that you could be successful in helping them engage in this public health effort.
Senator Hur.
Mr. President, Senator Benson, will you yield for another follow-up question?
Senator Benson will yield. Senator Hur.
Senator Benson, will you continue to work or work directly with senators from both parties in communicating the needs for multicultural outreach or intake information from community with language barriers, relay those information to the agency and to the healthcare facility that should be working with people? Would you be open to that leadership or leading that role as an ongoing process?
Senator Benson.
Thank you, Mr. President. And Senator Hur, if you would help me to do that, I am happy to participate. I think you would be more effective in leading me there, and I will be happy to support where you're going. So thank you.
Senator Hur.
Thank you, Mr. President. And thank you very much, Senator Benson, for your response. And as each of us as a senator, we all have our unique perspective, and my perspective is very, very different, being that I'm a person of refugee background, have unique struggle living in inner city, and sometimes being looked at as an outsider than an insider. And so I'm just want to say that when I look at this bill, I'm worried for all Minnesota, and at the same time, I also worry for our healthcare facility not being able to do intake on our most vulnerable communities, and we may miss on fully handling the containment of this COVID-19 virus here. So, but then at the same time, I'm hopeful, and that's why I'm speaking up to put this on the record so that it's here for agency and for our senator legislature to hear that if we put everything holistically and forgetting the vulnerable, then maybe we may miss some opportunity. So I just thought I want to communicate that point to everyone, and I appreciate Senator Benson for a good response. So thank you very much, Mr. President.
Further discussion on the bill. Senator Marty.
Sure, Mr. President, thank you. This is a serious crisis, and this bill is an excellent start to addressing health care concerns about it. I urge your support.
Seeing no further discussion, the Secretary will give Senate File 4334 its third reading.
Senate File Number 4334, a bill for an act relating to public health.
third reading. Final discussion on the bill. Senator Nelson.
Thank you, Mr. President. I rise in support of Senate File 4334. Just like Minnesotans all across our state, we have watched as the coronavirus COVID-19 has spread across the globe, into our country, and into our state. Minnesotans are paying attention. Minnesotans are working together to support one another, their families, their communities, and their health care providers. I'm glad that today the Minnesota Senate and Legislature have come together, the Minnesota Senate and House have come together in quick manner to get additional emergency funding out the door right away to make sure that we can test, diagnose, treat COVID-19. We believe we can slow the spread, and measures are being taken all across the state to do that. The money that we appropriate tonight will definitely help slow the spread and save lives. I do want to address one item, and that is those who have said that, well, there's only 50-some cases in this state. And are we overreacting? And are we overspending? Clearly, this is a case where an ounce of prevention is worth a pound of cure. I want to make sure that all members and Minnesotans know that if any of this, the original $50 million or the $150 million that can come out in grants as well, if any of those dollars are not spent on COVID-19 testing, treatment, and support, those dollars will return to the general fund. So members, this is an unusual, necessary, and immediate step that needs to be taken in these unusual times. And I'm glad that we are going to pass this and get this into the hands of our communities, our healthcare providers, and our people quickly. Thank you.
Final discussion on Senate File 4334. Senator Senjum.
Thank you, Mr. President. I just want to stand quickly and thank Senator Benson, I think on behalf of all of us, for her gallant effort on behalf of this cause. It's important, and I know it's a lot of hard work, and she deserves our thanks. So thank you, Senator Benson.
Members, final discussion on Senate File 4334. Senator Benson.
Well, I want to take this opportunity. We don't usually do thank yous like this till you get to the end of session, but it's felt a little bit like May today. I want to thank Eric Nauman and Katie Kavanaugh and Dennis Albrecht, and Liam Monahan, and all the folks in Senate Council who just dive in and make things happen and get it right. And it matters so much. To Bailey and Larissa and Ryan, you started out this morning with a good laugh and will end this morning with a good laugh, I'm sure. I'm grateful for your work. I'm really grateful for Senator Rosen, Senator Ralph, Senator Klein, and Senator Marty, because it gave me people to bounce ideas off of who I trusted had the same motivation that I had. And so even if I was a little off, I had somebody that I could turn to. Hearing from hospitals and having Senator Klein to reach out to and say, is this making sense to you, helped me understand some of the importance of what this bill did. But mostly, I want to say thank you to our healthcare system, the people who work in it. We count on you, and we are with you, and we are grateful for you. And with that, Mr. President, I recommend that Senate File 4334 be recommended to pass.
Members, we're on Senate File 4334. Is there any final discussion? We're on final passage of Senate File 4334. Seeing no further discussion, the Secretary will take the roll. All members having voted who have the desire to vote, the Secretary will close the roll. There being 55 ayes and 0 nays, the bill is passed and its title agreed to. Remaining under motions and resolutions will revert to the third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce the adoption by the House of the following House concurrent resolution herewith transmitted. House concurrent resolution number 3, a House concurrent resolution relating to the adjournment of the House of Representatives and Senate until the public interest warrants it. Patrick D. Murphy, Chief Clerk, House of Representatives.
Senator Gazelka.
Mr. President, I move the adoption of House concurrent resolution number 3.
Discussion, Senator Bach.
Well, Mr. President, I'm pretty troubled by this resolution, and maybe Senator Gazelka could explain to me what we're doing here. But, you know, the Constitution is pretty clear that we can't adjourn for more than 3 days without permission of the other body. And that's what this does. And it sets a date that we're going to come back on April 14th, which is normal, that we'd set a date when we're going to return. But it's this other language, Senator Gazelka, that's problematic to me. And it says, basically says that the Speaker and yourself can call us back at any time and before the date that we prescribe in here, which is April 14th. And I'm troubled because the Constitution says we can't adjourn for more than 3 days, and it also says, after meeting at a time prescribed by law, the legislature may adjourn to another time. To another time. It doesn't, the Constitution doesn't say that we can vest that authority in the leaders of the House and Senate to call us back basically any time that they want. And you know, and I know the rules. I've been around here long enough to know something about the Senate rules is they are what the majority wants them to be, and I get that. It's always been that way. And the Senate rules in 14.1 says, the President shall take the chair at the time to which the Senate has adjourned, and then call for a quorum. So I really think, members, this is problematic. And then earlier tonight, I get a letter that was signed yesterday by the Majority Leader and the Speaker that says that we're not coming back April 14th. We're coming back at some date before or not later than March 26th. So I'm just a little confused, Senator Gazelka. Maybe you can explain to me why this language is in here. I think it's pretty questionable constitutionality, and I realize we've got some pretty unusual circumstances on our hands, but I think we probably would have been wiser to come back every 3 days than to vest all the power in you and the Speaker to decide when we're coming back. So, Senator Gazelka, maybe you can explain to me how we ended up in this position where we say we're going to come back on April 14th, and the letter comes out then yesterday that says no later than March 26th. Because I'm just a carpenter and I'm a little bit confused.
Senator Gazelka.
Mr. President, Senator Bach, I thank you for those questions. Well, first of all, let me just say, members, it's extraordinary times. In my lifetime, I've never witnessed what we're traveling through. I don't know what kind of impact it's going to have on the market. I don't know how severe it's going to be in Minnesota. And in my own caucus, we went back and forth about whether or not we should just be every 3 days and stay the course, or heed the advice of the CDC and our own health department and those that thought that we can actually bend that curve if we just stay out of here. And so we set the date of the 14th, but we also knew that what if we needed to come back, what if the governor had something that he wanted to do that we didn't want him to do on his own. We wanted the legislative bodies to be part of the solutions going forward. We feel like there should be more accountability to the governor as far as the powers that he has invoked. We want to be here for that. And so we wanted the flexibility, but I agree that it's not perfect. And frankly, the letter out to come back on the 26th was a commitment to my caucus that we were actually going to come back sooner than the 14th. But the problem with the 14th members was the other body didn't have 90 members after today, and they needed that to suspend the rules, and so here we are. So that's a long way to say, just vote for the resolution.
Senator Bach.
Well, as long as we have time on our hands. So, Senator Gazelka, what day are we coming back? Do we know? Clearly by the letter, it's not April 14th, but it says no later than March 26th. Is it March 26th, or is it March 24th, or is it Thursday this week? Can you give us a little idea? You missed earlier today when we said we were going to go back about 5 o'clock. So maybe you can give us a little better idea kind of what day we're going to come back. It'd be helpful, I think, for those of us that, in all seriousness, these are extraordinary times, and those of us that are going home into our communities are going to be dealing with a lot of school boards wondering what's going on at the Capitol. And we're going to have to deal with that, with county boards, with business owners. And we're going to be setting up meetings with people, I would say probably for days, as we enter this period of time where much of our state is going to be pretty incapacitated. And so I think to the extent we can have maybe even more than 2-day notice, which I realize is what this says, so we don't have to cancel meetings with constituents back in our district when they're wondering what all is going on here, because this really is being driven out of St. Paul, and it's going to have a huge impact on the livelihoods of a lot of people in this state, tens of thousands, maybe hundreds of thousands of people. So I do think we have an obligation to try and share with them the best information we have as to what's going on here at the Capitol. And so to the extent you can, if you don't know tonight, if you can let us know kind of what day so that people don't get meetings back in their districts with people who feel like their lives are being put on the edge and then have to cancel them, I think that would be helpful to all of us and helpful to our institution.
Senator Gazelka.
Mr. President, Senator Bach and members, I think tentatively we want to shoot for March 26th, but I also want to be nimble enough that if we have something extraordinary that we need to be here, because we don't know exactly where this is going to go. The worst case scenarios are in fact scary. I'm hoping it's the opposite of that. I'm hoping that the things we've done give us a best case scenario where we just come back March 26th and there's maybe not as many things to do there as we're watching this. But that's the tentative date is March 26th, but really stay flexible at some level, 48-hour notice.
Any further discussion on House Concurrent Resolution number 3? Seeing none, Senator Gazelka renews his motion to adopt House Concurrent Resolution number 3. All those in favor say aye. Aye. Those opposed say no. Motion prevails. Resolution is adopted. We have, under motions and resolutions, we'll continue under the third order of business. We have a message from the House. The Secretary will read the message.
Mr. President, I have the honor to announce the passage by the House of the following Senate file herewith returned. Senate file number 3878, a bill for an act relating to transportation, providing for deposit of certain revenues and security for certain federal loans. Patrick D. Murphy, Chief Clerk, House of Representatives.
There's no action required on that message. We will move to the 13th order of business. Announcements of Senate interest. Without objection, the following senators will be excused from today's session. Senators Latz, Rest, Carlson, Dietzick, Pappas, Newton, Eaton, Lane, all day. Senators Clausen, Torres-Ray, Housley, and Sparks from 1:30 a.m. to the end of session. Members, are there any announcements of Senate interest? Senator Gazelka.
Mr. President, will the Senate do now adjourn until, according to the resolution, Tuesday, April 14th at 12 noon?
On the motion to adjourn, all those in favor say aye. Those opposed say no. The motion prevails. The Senate is adjourned.